Our next speaker is Kristin Moore, coming to us from University of Virginia, and she'll be talking about the development of an educational workshop on the practical application of respiratory motion management techniques for radiation oncology trainees.
All right, thank y'all for the introduction. I'm Kristin Ward. I'm currently a fourth-year resident at UVA. We're keeping the theme with UVA today. So I'm going to be talking about this educational workshop that I helped develop, discussing respiratory motion management techniques for radiation oncology trainees. So we know that respiratory motion management consists of several different techniques that we use on a daily basis in radiation oncology, including DIBH, abdominal compression belts, respiratory gating. And these tools are really important in limiting the motion or tracking the motion of tumors or targets during the respiration cycle. This allows for optimization of patient care by improving the safety and efficacy of radiation treatment delivery, and that we're able to dose escalate to the targets or the tumors while limiting the dose to normal organs at risks. Motion management is increasingly being utilized today in the era of image-guided radiation therapy. So really important for trainees to know this information. Which specific motion management technique is implemented depends on the clinical scenario and requires input from the treating physician or resident, physics, as well as dosimetry. So it's really a multidisciplinary approach. However, we found that there was a lack of formal education on the various motion management techniques. But like I just said, the knowledge of these tools is essential to treating intrathoracic as well as abdominal tumors. So the purpose of this initiative was to develop a formal and hands-on educational experience for our radiation oncology trainees that demonstrated what motion management techniques we have available to us and when to implement these specific techniques. So showing them the clinical scenarios that we need to appropriately implement these tools. So we know that there's not a one-size-fits-all approach to motion management. We can't just slap on an abdominal compression belt on everybody. So it's really something that we have to individualize to each individual patient. So the goal of this initiative was to increase trainee confidence and knowledge on this subject so that we can utilize these tools effectively in practice. So this was a two-phase educational workshop that was designed for medical and physics residents as well as medical students to participate. It consisted of a 45-minute interactive didactic session that covered the various motion management techniques that we have available, as well as includes some clinical examples. So the trainees had to choose which motion management technique should be used in this clinical example, followed by a 45-minute hands-on demonstration of the various motion management tools that we have available at UVA. Also showed the software that we use for motion evaluation. So each participant completed a pre and post workshop survey assessing their confidence or how comfortable they were with the motion management techniques. So this consisted of 8 questions based on a 5-point Likert scale. And then they also filled out knowledge-based quizzes that was consisted of 8 multiple choice questions. So for statistics, their scores were paired for analysis using the Wilcox-Stein rank and student t-tests. So this is just an example of one of the cases that was shown during the didactic session. So we were actually able to pull up the Signovia, which is the software system that we use to analyze motion management. So we had a post-op pancreas case. We showed the analysis of the free breathing scan using 4D CT scan and then a DIBH, and had the trainees choose which one looked better and helped them go through how to analyze a 4D CT scan and what that means. And then this is an example of the hands-on demonstration. So here we're at our CT sim and we're actually looking at, and the trainees actually helped perform this, which I think was also very important in terms of learning and explaining to our patients on a daily basis. But I was doing DIBH here, using the visual coaching here in 2021. And then the picture on the right is Alex, our PGY2, doing an abdominal compression belt. We also showed how to generate a CD, I can't speak to it, 4D CT, and also demonstrate what respiratory gating would look like and when to use that. And then we also discussed, other motion management techniques that we don't necessarily use on a daily basis at UVA, but we have slow CT scans, active breath hold, as well as real-time respiratory tracking that we discussed. So the results for this initiative, the workshop was held for 2 consecutive years. So we held it back. The first one was in 2021, and we held it again earlier this year in 2022. The first year consisted of only 7 participants, so it was 5 medical residents. You can see it broken down by the year. So we have, a little bit more advanced trainees in their education, and then we had 2 physics residents in 2021. This year we had 9 participants in total. We opened it up a little bit more, so we had some trainees that were earlier on in their career. We had some medical students, and then you can see the breakdown by the PGY here. But just notable that there is a little bit, there's more trainees that are earlier in their career in this 2022, which makes sense for the results section as we go along. So there was an increase in the self-reported post-workshop confidence and motion management techniques. This is based on the Likert scale again. So in 2021, the median score was 3.6, pre-workshop versus 4.6, which you can see here on the left side. And then in 2022 is going to be the right bar graphs, which there's a bigger difference again with the trainees that were earlier on in their career, lower pre-post workshop score, and then the post-workshop score was significant, 3.8. And then for the knowledge-based quizzes, there was also a significant increase in all the participant scores. Again, there's a bigger difference in 2022 compared to 2021, but the trainees also gained more knowledge in their motion management techniques following the workshop. So in conclusion, motion management is an important clinical tool for optimizing patient care and safety, and it's critical that our trainees are familiar with these techniques when they're treating tumors, particularly in the thorax and the abdomen. The study demonstrated that a dedicated educational workshop on these tools significantly improves trainees' knowledge and confidence in the implementation of these tools. And for future aims, we hope to continue to offer this workshop annually for our new trainees, since we see that this is something that really benefited them the most. As well as to assess knowledge retention. So as they continue their medical education, do they retain these motion management technique tools and when to implement them? And eventually it'd be nice to create a shared resource between institutions who can get more input. Special thank you to all of my co-authors, Dr. Janowski again for being my mentor, and thank you guys for your time.